All right, good evening, everybody. It is so nice to meet with everybody again. We have the privilege of having another opportunity to discuss with somebody their own personal experience with some of the remedies that are sometimes not considered as conventional. So tonight I have a guest with me, but before I go to that, I just want to say thank you again to those of you who are signing in. I want to encourage you as we are having our discussion to, by all means, share your comments and your questions in the comment section. And if you have specific comments or questions to either our guest speaker or to me, you're welcome to type them in the comments and we'll keep an eye on them and probably answer them either as we go or at the end. Also, just another thank you to my husband. He is sitting in the background working through all the technical stuff, and yeah, we wouldn't be able to do these interviews if it wasn't for his help, so I'm very grateful for that. Now, tonight our guest is a special lady from, if I understand correctly, from Bethlehem in South Africa. So, Sané, thank you very much for joining us tonight, and thank you for sharing your story with us. I know sometimes it's not only stressful to have events, stressful events in your family, especially when it comes to your children, but it's also very emotional. So we appreciate that you have taken the time to come and share a little bit with us. I was wondering, I know that you have your little ones in the background there, so we're going to try our best not to keep you busy for too long. But I was wondering if you can maybe just share with us briefly sort of how things happened. To my knowledge, there was an injury that sort of resulted in one of your little ones ending up in hospital for surgery. Do you want to tell us a little bit more about that?
Ja, Sanri het 'n ongeluk gehad met haar arm en toe het sy die operasie gekry die 7de Januarie en die 13de Januarie toe trek sy haar arm uit die gips uit en toe is haar arm smerterig en sy het penne in haar arm ook gehad en toe jaag ek dokter toe om te hoor of ek nuwe gips kan opsit en goed en toe het hulle in die spreekkamer die penne somme uitgetrek want hulle sou dit eintlik onder narkose gedoen het. Maar toe trek hulle dit somme in die spreekkamer uit en goed en toe sê hulle ek moet gips opsit, maar ek moet nog steeds die wond skoon hou. Toe verstaan ek nie lekker hoe moet ek altyd gelyk doen nie. En toe het ons na ons GP toe gegaan en toe het sy vir ons medikasie antibiotika voorgeskryf en so aan. En die Vrydag voor sy weer teater toe moes sy gegaan het om die wond onder narkose toe my te traineer en goed. Toe het my skoonma jou gebel en goed. En toe vra sy wat kan ons doen en goed en toe het jy vir ons die potjies idee gegee. En binne 8 dae het ek resultate gesien wat ek nie gedink het ek sou gesien het nie. En ek is baie bly daaroor dat ek dit gedoen het.
So, if just for the sake of our viewers, I'm going to just repeat what you said and summarize that in English. So for those of our viewers who don't speak Afrikaans, Sané is an Afrikaans-speaking South African, and I'm once again very grateful that she's agreed to chat with us, especially on an English platform. Sané, if I understand correctly, basically how things happened is that, just remind me again, your little one is 2 years old now, right? She's one of a twin?
18 months, yes.
18 months old. Okay, so she's 18 months old. She had an accident that resulted in her arm being broken, and she ended up going to surgery. They did a surgical sort of setting of that broken bone, and they also put pins in to set that arm, and then they also put a cast over that. Now, for those viewers who are listening in, the trauma that a child goes through in that process is severe. It is quite an experience. Of course, they do use anesthetic for the procedure, which I'm sure that she also had, but it's still quite a big event for any young child to go through because it's a hospitalization, the theatre process, and then the cast and all of that is quite a process. So if I understand correctly, she then had that cast on for some time, and that cast came off, which is actually quite common to happen because as the swelling from the initial injury goes down, the cast becomes a little bit more loose on that arm, which is, if I would guess, that is exactly what happened in her case. So then her arm came out of the cast, and you went to, as you said, your home GP or your house doctor to assist with figuring out, okay, what is the next step? Because she was supposed to have the cast on for a little while longer still. At that point, as you mentioned, they actually took the pins out in the GP consulting rooms. And you mentioned and you touched on a very important point. And before we move on to the treatments that we then continued to do, I think let's pause for a moment on what happened in that GP office. What they recommended to you there was that they're going to put another cast on, but they also told you that there's an open wound on that elbow now, which has to be kept clean where the pins were taken out. Now, I'm pointing this
Yeah.
out not to actually, highlight that the doctors were ridiculous or that they gave stupid instructions. That's not the point at all. It is just a common thing for people sometimes to go to medical professionals in any setup, not necessarily in private. It could be private or government, it could be in any area worldwide for that matter. And it's not uncommon for people to actually get instructions from their doctors that don't seem to make complete sense to them. They don't always understand the logic behind it, or it feels like it's not practical. And in your case, as you said,
Yeah.
you were very worried because you didn't know how you were going to keep these the wounds clean, and then they prescribed antibiotics.
Mm.
Now, if I remember correctly, when I came into contact with you and when we spoke for the first time over the phone, it was the Friday, and the plan was for your little girl to go back to theatre the following day. So that was what their plan was, is to actually take her back to theatre because that area had become infected. How many days was the gap between them taking the pins out and them noticing that infection? How long was that gap?
It was the 7th that she had the operation,
Mm-hmm.
January, and the
Yes.
13th we went back to the doctor for
Okay.
when she take out of the cast.
Yes, yes. And then it wasn't very long after that
Mm.
that we spoke over the phone and that area had become very badly infected. So I'd
Ja,
like
ek dink
Adrian maybe. Sorry, yes, go ahead first.
sorry, ek dink dit was 'n Dinsdag of 'n Woensdag wat dit gebeur het, toe ek
Ja.
dokter toe gejaag het en die
Mm.
Vrydag het ek jou toe gebel. Ja.
Okay, dit maak sin. So dit was basies twee dae gewees, wat dit jy weet van die tyd wat daai penne uit is totdat die infeksie ingekom het. So
Ja.
within 2 days after them taking the pins out, there was infection in that site. Now, before we go to the pictures, we want to just mention we're sharing pictures just of the elbow, and it just shows the wound area. And obviously, we don't want to gross people out. But the reason why we want to share these pictures is because it becomes relevant when we're trying to evaluate whether the natural treatments actually did something or whether it was kind of coincidental that this became better. Because sometimes we can think, oh, for minor injuries, it would have gotten better by itself anyway. But I think the pictures will help our viewers to understand that this was a very serious infection. So this is a picture that you sent me. I can't remember. I think it was actually the Friday. This area had
Yes.
become very, very swollen. And please correct me if I'm wrong, but the things that you reported to me that I recall is that there was severe swelling around her elbow area, which is exactly at the site where the pins were taken out. But it wasn't only
Yes.
the skin that was inflamed where the pins came out, it was the whole joint that was inflamed. So there was inflammation
Ja.
over the whole joint area. The whole area was swollen. You can see some of that on the picture as well. And it had made a little
Mhm.
abscess on the point there. But the very fact that the doctors who saw her booked her for surgery or was planning to do surgery the following day indicated that they expected that this infection was not only on the skin surface, but that it had actually gone into the joint space. Now, I'd like to also just emphasize for the viewers who are watching what the implications are of this. Infection on the skin surface is one thing, but infection that goes into a joint space is a medical emergency. It is regarded as a medical emergency, and therefore, their suggestion to take her to theatre was not out of the ordinary, and it wasn't really over the top, exaggerating the seriousness of the situation. It was a very serious situation, and she was in severe pain. She was very uncomfortable. You can maybe explain to us a little bit more about what her symptoms were that night when we spoke on the Friday, that evening while we were, that very first evening when you were actually still needing to evaluate whether or not to take her in for the surgery on the Saturday. What was it that you saw in her? How was she holding the arm? Was she able to move it comfortably, or how painful was it when she was moving or when you were touching that area?
She would not use the arm. She would hold it still in one position, and she was very crying and very grumpy. I
Mm,
could not handle her. My husband helped me to calm her down. She
yeah.
was, sy was baie moeilik geweest.
Yeah,
Ja.
she was really, really uncomfortable. And if I remember correctly, you also said to
Mhm.
me at that stage that she had temperature spikes, so her body was mounting a systemic fever response as well, if I recall
Ja.
correctly. All of those things indicate that this was, for all intents and purposes, a very serious infection in that arm. And the risk if infections go into the joint space is that you can actually lose the functionality of that joint on a long-term basis. In addition to that, the infection can track into the lining that surrounds the bone, which actually means that infection can track up her arm into other areas. So it really was a serious infection. And I think you recognize that, and I recognize that. And one of the reasons why I felt that we should do this interview is to encourage other people, because I think both of us knew on that Friday already that this was a risky thing to handle at home. And even the mere suggestion of her potentially not actually going into theatre the following day was something that I think you took very seriously. And it wasn't a joke. It wasn't just something that you took as a, oh no, I don't want to take her to hospital kind of thing. You were seriously trying to evaluate whether it was absolutely necessary, and the possibility that the natural treatments would help things, I think, was something that both of us were very cautious about. We were not 100% sure that it was really going to work. So
Ja.
we will be very honest
En
with
ek
our
dink
viewers about that.
ook nie die antibiotika sou so effektief gewerk het soos wat die poultices het nie.
Absolutely. So let me mention then what what the treatments were that we suggested at this stage. Obviously, the doctors prescribed antibiotics for her, and to my knowledge, I knew that she probably would have received a number of other medications in the previous weeks because she went to theatre, so she had all the anesthetic. They would have given her antibiotics at the first procedure as well because it was an open orthopedic procedure. So I knew that her body had already received a lot of medications, and with that in mind, I mentioned to you at that stage that there is a risk with giving her another course of antibiotics. Of course, with antibiotics, we want to treat the infection, and when we are suggesting to somebody not to use antibiotics, sorry, dogs in the background. When we're suggesting to somebody to hold off on antibiotic treatment, it's never a suggestion that says, oh, you don't need to treat this. That wasn't what we recommended at all. However, one of the cautions with antibiotics is that when we give another course of antibiotics, it actually reduces the immune system's effective functionality. Antibiotics have a suppressing effect on the immune system, but they also damage the natural gut flora, which further reduces the immune system effectiveness. And there's other ways in which it adds a toxic load to the system. It increases toxicity to the liver. It has an extra load that it often affects the kidneys with. So it actually increases the workload of that little body. And that was the reason why I cautioned you at that stage, because I knew that the antibiotics could actually make it harder for her body to fight the infection. Now, many people say, well, that is okay because the antibiotics are going to do the job of killing the bacteria. But the reality is that the antibiotics don't always target the exact bugs that cause an infection. The immune system is actually able to mount a more specific response to different kinds of bacteria and organisms. And that's one of the reasons why we actually want to get the immune system as strong as possible and to mount a strong response in infections, which is why it is difficult to then, with that in mind, give medications that we know that actually suppresses the immune system. So in your case, what we suggested was that we actually give her multiple different treatments to try and help her body. So we made suggestions to give her different things that help to boost her immune function. I suggested that you use poultices over that wound area. We suggested hot and cold treatments, which will boost the blood circulation through that area, as well as help to wash out infection. And we suggested specific poultices that help to draw out not only toxins, but also actually to reduce inflammation and reduce swelling of that area so that it boosts the blood circulation. Now, can you remember, and do you want to maybe tell our viewers a little bit about which poultices you ended up using?
Ek het die bentonite klei gebruik met die turmeric. Dit was die eerste poultice gewees. Die tweede ene was gerasperde aartappel met charcoal, activated charcoal en dan net 'n bietjie flaxseed meel om hom te bind.
Yeah.
En dan die derde ene was gemmer met gerasperde ei gewees.
Excellent. So there were three main combinations that I suggested to you. And the reason for those combinations were because they actually do slightly different things. So we suggest usually to alternate between the different options. The one that you mentioned was bentonite clay and turmeric as a mixture, which I knew would help to draw out some of the toxicity, but it also has an anti-inflammatory effect. So it helps to soothe and potentially helps for pain. Then the other one was a grated potato poultice. And when somebody first told me many years ago, like 3-4 years ago, to use potato poultices, especially on abscesses or wounds, I thought they lost their minds, because I thought to myself, how on earth is a potato going to help for an infection, especially for something as serious as this, where there's an infection in a joint space. But potato is a remarkable drawer, and it helps to draw not only inflammation, it through osmosis it helps to draw the swelling, but it actually helps to draw the pus towards the surface, and it helps for that abscess to naturally open up and the pus to start draining, which, if I remember correctly, that's exactly what happened. This is a picture, just, I think it was on day 2, it was like on the Saturday sometime that you sent me this one, where that little boil actually opened up and it started to drain a little bit by itself. And then we also use the other, the ginger and the onion poultice, which is a natural antibiotic mixture, but also the ginger helps for pain relief in bone tissue, deep tissue. And the idea was to kind of help to manage pain, inflammation, and treat the infection all at the same time, which we combined with the things that we were trying to give her internally, like echinacea and that sort of thing. So at this stage, it started draining a little bit. But I remember on the Saturday, you were still wondering, should I or shouldn't I actually give the antibiotics? Because, of course, one is worried that this is actually going to clear things up. What was it that motivated you on that day to actually not go for the surgery and to continue trying these natural things?
Skus weer.
No problem. Sorry, we're interrupting. Please take a break if you need to help her with anything there. My question was, on that Saturday that you were actually going to go to theatre, what was it that gave you enough of a motivation on that day to hold off on the surgery, to hold off on the antibiotics, and to keep trying the poultices and the hydrotherapy? What did you see on that Saturday that made you think, well, this might actually be working?
Ek dink wat my bietjie gerus moet gegee het is omdat hy begin dreineer het ek gedink okay nee, hou maar net aan met dit. Dit sal beter word en goed. As dit erger word teen dag 4 of 5 en hy begin nog meer rooier te word of weer op te swel of iets, dan sou ek weer terug hospitaal toe gegaan het. Maar toe ek soos die elke dag verbetering gesien het van hierdie wond, toe het ek maar net aangegaan met die poultices.
Yeah. I think you raised a very important point there, and please do correct me if I'm wrong. At no point did we decide between the two of us, oh, we're not going to go for the standard treatment, we're not going to go to hospital, you're just refusing. It was not a matter of refusing the recommended treatment. It was a matter of trying to find alternatives that don't have as much of a risk, in the hope that it would work. But we were monitoring things literally every single day, and I know we were in discussion more than once a day usually for the first few days. And as you mentioned, rightfully so, you saw improvement very quickly. You saw that abscess was actually opening up and the pus was draining out within the first 24 hours. And after that, every single day you saw improvement. This next picture that we have on the screen here shows, I think it was 2 or 3 days after you started using the poultices, where it was making, there was a little, almost like a little scab, but from time to time the pus was still draining, and then obviously the overall swelling here was much better than initially. The swelling of the joint was better, and the redness was not as aggressive around the wound, which all indicated improvement. And then, if I remember correctly, she was also a little bit more comfortable. She was not quite as distressed as she was initially. So you had different things that indicated to you that she was actually improving and responding to this treatment. Now, before we go to the last picture, maybe you can also just briefly share with us how you combined the poultices. Obviously, you didn't only use the poultices, you also used hydrotherapy. How did you manage with doing the hot and cold hydrotherapy for her? We can maybe just wait with that next picture so that we'll explain that in a minute. So in terms of the hydrotherapy, what were the main things that you used for the hot and colds?
My man het my gehelp met dit. Ek het haar vasgehou en dan het hy die armpie gevat en dan in warm water gesit en dan dadelik in koue water. Ons kon dit nie vir langer as 'n minuut inhou nie, maar dit het gehelp om net om in te dip kort in koud en warm water. So ja, ons het dit 'n hele paar keer gedoen en toe het ook
gehelp. That's amazing. Maybe I'm going to very quickly just explain to people what the hot and cold treatment is that we recommended. And please, by all means, if you need to take a minute with her, that's not a problem. In brief, the hot and cold treatment that we recommended in this particular case was to switch the arm back and forth from keeping it in warm water and then keeping it in cold water. And we were trying to assist the body basically with improved blood circulation through that area. We wanted to help her arm to reduce the swelling, but in particular for the blood circulation to be boosted through that area to such a point that the immune cells could reach that area and fight the infection as well. And it one of the things that you mentioned is a practical implication as well. Sometimes it's not even possible for people to do it exactly as we kind of recommend it to be done. Normally for hot and cold treatments, we recommend that the part that is affected is switched back and forth between the hot and the cold treatment, or hot and cold water, 3 minutes on the warm side, 30 seconds in the ice cold water, and switching back and forth. And it's not always possible to do it exactly like that. But sometimes, even if you're able to do just a version of that, it already helps. And in your case, like you mentioned, you were able to switch that arm back and forth, even if it was just a minute on the one side and a few seconds in the cold side, it already had an impact. So that is really wonderful. I'm pretty sure that she is requiring your attention. So I'm going to see how we can wrap this up very quickly. We're going to show one last picture, or two. One complication that you experienced from using the poultices for a few days included that rash that developed on her arm. And of course, this again, many people would be terribly worried about this. But what I noticed when we saw this rash is, number one, the initial swelling was still gone. The area where we were worried about it, that had the abscess, that had actually cleared by the time that this rash developed. And I think you very rightfully noticed that this rash was basically just from having poultices on that arm repeatedly and having used plastic on the arm to keep them in place. So we switched from the plastic to bandages. How quickly did that rash actually clear up? We recommended a couple of essential oils and things like that. How long did it take for that rash to go away?
Dit was seker so 'n week gewees wat hy opgeklaar het.
Mm. And it became lighter every day. It wasn't like it was spreading and the rash got worse and
Nee,
worse.
hy het bietjie erger begin word, maar toe na 'n rukkie toe begin hy weer bietjie op.
Okay. So sometimes, of course, using poultices, especially when using them for the first time, and especially when using them on children, one has to kind of work through the different practical things that are necessary. We're going to end off with one last picture that shows the elbow. This was after 8 days, I think that you said. It had basically gotten to the
Ja,
point that it had cleared up.
ja.
It was really remarkable, and many times when you give antibiotics for a joint infection or for an abscess overlying an area where there was surgery to a joint, we would normally expect that children often would end up with a double course of antibiotics, which means it would take about 14 days, in addition to going to hospital for surgery, where they do a surgical washout of that wound. In this case, she didn't have the surgery and she ended up not having that course of antibiotics at all. She only used the natural treatments, and that whole area cleared up remarkably well. Are there any other thoughts that you would like to mention that stood out to you in this process as well?
Net dat ek in dit glo.
Yeah, I think, correct me if I'm wrong, but when you've seen it in action, it's very different to when somebody tells you, oh,
Ja.
we've used poultices and it worked. And if somebody says to you, oh, we used potato on an abscess, you would probably have your doubts until you actually put it into practice and you see the improvement that comes along with it. So we were also very happy to see the improvement. For me, it's not the first case that I have recommended this for, and it definitely wasn't the first case where I saw such improvement. But I was incredibly happy about this particular case because she's very small, and I was really, really praying that she wouldn't need to go back to hospital. And with that in mind, I also want to mention to our viewers that I know that people have different beliefs. Not everybody are Christian. I recognize that, and I really respect people's different viewpoints on this. But for us, we are Christians, and from a Christian perspective, I also believe that the poultices in themselves don't have their own power. I believe that the Lord works through the natural remedies, and I also believe that He provides them. It's God who made these remedies. They are natural things that He provided in nature for us, and oftentimes they are cheaper, and very often they're actually more effective than some of the things that we spend a fortune for when it comes to treatments that are recommended. So, Nay, thank you very much. We really appreciate your time. I see that there are some chats, but I don't see any questions that have come in. And we really appreciate that you were able to share your story. We thank you for your time, and I hope that the evening is going to be a blessed one. We thank your family as well for sharing you with us for the time that you were able to join in here.
Bless you. Dankie.
Thank you so much. As we're ending off to our viewers, I just want to say thank you for those of you who are watching our testimonies. These testimonies are not here to bring any negative view towards allopathic medicine or medical care from any particular doctor or anything like that. We are merely sharing these testimonies of the effect that we see with natural remedies because we're excited about them and because we're in awe, and sometimes our wonder for it is just growing. We're still surprised sometimes by how well and how effectively these things can work. If you have any particular experiences that you have had, if you have seen something that you've tried yourself in your own home and you'd like to share it with us, please do so in the comment section. Or if you'd like to contact us to share your personal experience on an interview, you're welcome to contact us for that as well. We want to say thank you for those of us, or for those of you who have joined again, and we hope to see you again next time. Have a good evening.